Thank you. What do we got? Well, I'm really delighted to be here tonight, this afternoon with you all. This is the sixth time I've been before you asking for your vote. That's a precarious thing to do now because of the condition of the economy in the United States. The situation seems to me like, how many of you have been on a cruise? Have you ever been on a cruise with those great big ships? Yeah, me too. The situation is like we're on a cruise ship, a big ship, sort of hard to steer because you didn't know what's going on. And there's been a storm, and it's been a really bad storm. And the passengers get pissed at the captain and the crew because he can't stop the storm. So their proposal is they throw the whole crew overboard and have the passengers take over the ship. And that's the political statement in the United States today, and it's not just in Oregon. It's in lots of other places. It's easy to be mad at the captain when the storm keeps raging, and in Oregon, the storm still rages. Now, we really need to keep doing something about that, and I've been in the legislature now. If I'm elected, if you have confidence in me and re-elect me, it will be my 5th term. I served the first 2 years in the Republican-run legislature. And the thing we need to remember about the storm we're in is that 16 of the last 20 years, the Republicans have controlled the legislature. So what's gotten us to where we got today in terms of the state legislature is 16 years of Republican lack of leadership in looking ahead to solve the problems of the state, and 4 years of Democratic-controlled legislature. And we've done some extraordinary things in the 4 years since we took over, in spite of the complexities of the financial situation. You didn't even remember that one of the reasons Oregon is in the bottom 10 on some of these measures is that we're also in the bottom 10 in the total amount of local and state taxes collected per capita. We're even lower in terms of the business taxes collected per capita. So basically, we have what we pay for, and our revenue system has produced a bottom 10 revenue package, and we've responded with a bottom 10 education package, including higher education and things that have really happened. And that's the accumulation of the last 20 years of legislative decisions. We hope we're coming out of that. I enjoyed serving in the Republican legislature, actually. And in 2003 and 2005, I passed 13 bills, of which I was the sponsor or the chief co-sponsor during that time period. I worked well with my friends across the aisle, many of whom aren't there anymore because they were responsible and behaved properly for the state. Their party took them out. But the fact is, it was actually fun working in that legislature. When I came into the House, I chose 2 mentors, both of whom were Republican members of the House at that time, Lane Shuttley and Ben Westland. And they taught me early on that you can accomplish a lot if you don't care who gets the credit. And that's been the sort of byword of what I've tried to do over the last 4 sessions and into the next one. You work very hard with the people who are willing to work with you and who have the spirit of trying to help the state. I've passed bills during that time, like House Bill 3613 in my first term, which I think was passed in the House with 17 Republicans and 15 Democrats. That's attempting to bring more capital into emerging Oregon industries. It's a bill that would require the Oregon Investment Council to invest about $100 million in emerging Oregon industry out of a $60 billion account, because we invest in venture capital, but we haven't done a very good job of investing in venture capital in Oregon. So we produce good ideas in the industries we have and in the universities we have, and then they move off to Palo Alto or Austin or Boston in order to find the venture capital that they need. And we have to change that. We fortunately have a very good treasurer right now who finally understands this, and we're beginning to move much more of those funds into supporting emerging organ industries, because as Democrats, we know jobs really matter. They really matter to this state, and as long as we're involved in basically an income tax form, jobs are the only thing that allow us to do what we need to do. As most of you know, healthcare has been very much on my agenda. And I've chaired the House Committee on Healthcare during the last 2 sessions. And over the last 4 sessions, actually, starting in 2003, we've begun to do what we can to try and deal with the question of the uninsured in Oregon. We've had in the past about 17% of our folks uninsured. That's a problem for everybody, not just for the uninsured folks. How many of you know somebody who's unable to get health insurance in this state? Your family or your friends? Yeah, it used to be when I first got involved in this thing, those people that didn't have health insurance, whoever those people were. It's not true anymore. It's our cousins and our grandkids and our next door neighbor that can't get health insurance. They do get sick, and I was telling somebody, I've been a Kaiser Permanente member for nearly 50 years now. When I get sick, I know where to go. I know what phone to call. I know what door to go into. And I said, people that don't have health insurance don't know where to go. And the answer was, oh, yeah, they do. They look for the blue sign. And I said, the blue sign? And they said, yeah, the blue sign with the H on it. Because they know if they're sick, they'll be taken care of in an emergency room and in the hospital. And we pay for that. All of us that have private health insurance pay for those people. 10% of the health insurance premiums that are swamping businesses today, 10% of those premiums are the cost shift from the uninsured to the insured. We pay hospitals, Michael knows this, he's very much involved in helping hospitals deal with their financial situation, including Kaiser Permanente. We in the past have paid about 50% of the costs for Medicaid people that show up in the hospital, about 85% of the costs for Medicare people that show up in the hospital, and 125% of the cost of care for when insured people show up. So the problem of the uninsured is not only a problem for people who don't have health insurance, it's a problem for people who do have health insurance as well. In 2003, we created Oregon Health Plan Standard, used a hospital tax that the hospitals were happy to pay because we gave it back to them dollar for dollar, and used that money to match federal funds to put people into the Oregon Health Plan that weren't there before. In 2005, we worked on health insurance again, and we created something called the Oregon Health Fund Board, which was a bipartisan board charged with giving the legislature and the governor proposals for restructuring health care and for moving eventually towards universal access to health care for all folks. They worked hard in the 2007 interim session and came back to us in 2009 with some proposals to restructure the health care system. I carried those bills through the legislature. We did House Bill 2009, which was 613 pages long, and restructured the healthcare system in Oregon. It made government smaller and more nimble by breaking the Department of Human Services into 2. It was just far too big a department for anybody to manage rationally. And we created in House Bill 2116 a health insurance tax of 1% that the insurers were delighted to do because we used that money to insure, mostly in the private sector, health care for all kids. We had 80,000 uninsured kids at that point. We've enrolled nearly 60,000 in the Healthy Kids Plan. Since that time, it's been a very proud achievement. And I'll be happy to answer things in the question and answer period. Thank you.